Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we will guide you through 120 multiple-choice questions and MCQs on fundamentals of nursing. Each question is carefully crafted to challenge your knowledge and help you develop a deeper understanding of this essential subject. You'll find detailed explanations after every question to ensure that you not only choose the right answer, but also understand the reasoning behind it. Whether you're just starting your studies or revising for exams, this video is packed with content to sharpen your skills, enhance your critical thinking, and reinforce key concepts in nursing fundamentals. Be sure to like, share, and subscribe to Nursing Exam Preparation for more valuable resources. Hit the bell icon to stay updated on our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work towards mastering the fundamentals of nursing and achieving exam success. 1. What is the first step in the nursing process? A. Diagnosis. B. Implementation. C. Assessment. D. Evaluation. Answer: assessment. Rationale: assessment is the initial phase of the nursing process, where the nurse gathers data to identify patient needs. Without assessment, accurate diagnosis and effective planning are impossible. 2. When should hand hygiene be performed during patient care? A. Only before patient contact. B. Before and after patient contact. C. Only after patient contact. D. Only when hands are visibly soiled. Answer: before and after patient contact. Rationale: hand hygiene must be performed before and after patient contact to prevent cross-contamination and the spread of infection. It is a critical component of infection control protocols. 3. A nurse is using a blood pressure cuff that is too small for the patient. What is the likely outcome? A. Accurate blood pressure reading. B. Falsely low reading. C. Falsely high reading. D. No effect on the reading. Answer: falsely high reading. Rationale: a cuff that is too small can result in falsely high blood pressure readings due to increased pressure on the artery. Proper cuff size is essential for accurate measurement. 4. Which of the following is an example of therapeutic communication? A. Why did you do that? B. Tell me more about how you feel. C. You shouldn't feel that way. D. I think you should do this. Answer: tell me more about how you feel. Rationale: therapeutic communication encourages patients to express their thoughts and feelings. It avoids judgmental or directive statements and helps build trust and understanding. 5. A patient with a latex allergy needs a Foley catheter inserted. What should the nurse do? A. Use latex gloves. B. Use a silicone or a latex-free catheter. C. Proceed without gloves. D. Delay the procedure. Answer: use a silicone or a latex-free catheter. Rationale: for patients with a latex allergy, using latex-free equipment and materials is essential to prevent allergic reactions. Silicone catheters are a safe alternative. 6. What is the appropriate action for a nurse when administering medications through a nasogastric tube? A. Flush the tube with water before and after medication. B. Mix all medications together. C. Administer the medication without checking placement. D. Crush all medications regardless of type. Answer: flush the tube with water before and after medication. Rationale: flushing ensures that the tube is clear before and after medication to prevent clogging and ensure the complete delivery of the medication. 7. A nurse suspects a patient has a pressure ulcer. What is the best initial intervention? A. Apply an antiseptic solution. B. Assess the skin and document findings. C. Massage the area to increase circulation. D. Request an order for antibiotics. Answer: assess the skin and document findings. Rationale: assessment and documentation are critical for determining the stage of the pressure ulcer and planning appropriate care. Massaging may worsen the condition. 8. When prioritizing patient care, which patient should the nurse see first? A. A patient scheduled for discharge. B. A patient reporting chest pain. C. A patient requesting water. D. A patient asking for assistance to the bathroom. Answer. A patient reporting chest pain. Rationale. Chest pain may indicate a life-threatening condition, such as a myocardial infarction, and requires immediate attention. 9. Which site is appropriate for checking a pulse in an unresponsive adult patient? A. Radial artery. B. Carotid artery. C. Brachial artery. D. Temporal artery. Answer. Carotid artery. Rationale. The carotid artery is easily accessible and provides a strong pulse in an unresponsive adult. The radial or brachial pulse may be difficult to detect in such situations. 10. A nurse is educating a patient on deep breathing exercises. Which instruction is correct? A. Breathe in through your nose and out through your mouth. B. Hold your breath for 10 seconds before exhaling. C. Exhale quickly and forcefully. D. Avoid breathing deeply to prevent dizziness. Answer. Breathe in through your nose and out through your mouth. Rationale. This technique encourages effective oxygen exchange and helps prevent complications like atelectasis, especially after surgery. 11. What is the primary purpose of using standard precautions in patient care? A. To protect patients from falls. B. To prevent the spread of infections. C. To reduce medication errors. D. To manage chronic conditions. Answer. To prevent the spread of infections. Rationale. Standard precautions, such as hand hygiene and PPE, are designed to prevent the transmission of infectious agents during patient care. 12. When auscultating lung sounds, which sound indicates fluid in the lungs? A. Wheezing. B. Crackles. C. Ronchi.
D. Stridor.
Answer. Crackles. Rationale. Crackles are abnormal lung sounds caused by fluid in the alveoli and are commonly associated with conditions like pneumonia or heart failure. 13. A nurse needs to obtain a sterile urine sample from an indwelling catheter. What is the correct method? A. Disconnect the catheter tubing. B. Use a needle to aspirate urine from the bag. C. Withdraw urine from the sampling port using a syringe. D. Collect urine directly from the drainage bag. Answer. Withdraw urine from the sampling port using a syringe. Rationale. The sampling port ensures a sterile collection method, reducing the risk of contamination and infection. 14. What is the best position for a patient experiencing shortness of breath? A. Supine. B. Fowler's. C. Trendelenburg. D. Prone. Answer. Fowler's. Rationale. Fowler's position promotes lung expansion and improves oxygenation by reducing pressure on the diaphragm. 15. How should a nurse handle a medication error? A. Report it immediately to the charge nurse or provider. B. Document it without informing anyone. C. Ignore it if the patient shows no symptoms. D. Discuss it with colleagues first. Answer. Report it immediately to the charge nurse or provider. Rationale. Reporting medication errors promptly ensures patient safety and allows for immediate corrective action if needed. 16. Which action ensures proper placement of a nasogastric tube? A. Injecting 10 milliliters of air and listening for a sound. B. Checking for gastric pH content. C. Measuring the tube's external length. D. Relying on patient verbal confirmation. Answer. Checking for gastric pH content. Rationale. Gastric pH testing is the most reliable method to confirm NG tube placement. Air injection is less accurate and not recommended. 17. A nurse observes that a patient's foresight is swollen and painful. What is the most likely cause? A. Phlebitis. B. Infiltration. C. Infection.
D. Thrombosis.
Answer. Infiltration. Rationale. Infiltration occurs when fluid leaks into surrounding tissues, causing swelling and discomfort. Phlebitis typically presents as redness and warmth along the vein. 18. What is the first step a nurse should take when a fire occurs in a healthcare facility? A. Rescue patients in immediate danger. B. Activate the fire alarm. C. Contain the fire by closing doors. D. Extinguish the fire. Answer: rescue patients in immediate danger. Rationale: following the RACE acronym, rescue, alarm, contain, extinguish. Rescuing patients is the first and most critical step in ensuring safety during a fire. 19. How should the nurse properly dispose of a used sharps needle? A. Recap the needle before disposal. B. Place it in a puncture-proof sharps container. C. Dispose of it in the regular trash. D. Break the needle and dispose of it. Answer: place it in a puncture-proof sharps container. Rationale: a sharps container is designed to safely dispose of needles, preventing accidental injuries or exposure to blood-borne pathogens. 20. Which nutrient is most critical for wound healing? A. Vitamin C. B. Calcium. C. Potassium. D. Vitamin D. Answer: vitamin C. Rationale: vitamin C plays a vital role in collagen synthesis, which is essential for tissue repair and wound healing. 21. What is the correct sequence for donning PPE? A. Gloves, mask, gown, goggles. B. Gown, mask, goggles, gloves. C. Mask, gown, goggles, gloves. D. Gown, gloves, mask, goggles. Answer: gown, mask, goggles, gloves. Rationale: this sequence minimizes the risk of contamination and ensures all protective barriers are in place before patient interaction. 22. Which action should the nurse prioritize when a patient begins to fall during ambulation? A. Try to prevent the fall. B. Gently lower the patient to the ground. C. Call for help immediately. D. Assess the patient after the fall. Answer: gently lower the patient to the ground. Rationale: lowering the patient safely prevents severe injury and allows for proper assessment afterward. 23. A nurse observes a patient with restraints. What is the minimum frequency for checking the patient? A. Every 4 hours. B. Every 2 hours. C. Every 30 minutes. D. Every hour. Answer: every 30 minutes. Rationale: restraint use requires frequent monitoring to ensure patient safety and to assess the need for continued restraint. 24. What is the proper action for handling soiled linens? A. Shake them out to check for foreign objects. B. Place them directly on the floor. C. Roll them inward before disposing. D. Carry them close to the body. Answer: roll them inward before disposing. Rationale: rolling soiled linens inward prevents the spread of contaminants, reducing the risk of infection. 25. How often should a patient in bed be repositioned to prevent pressure ulcers? A. Every 2 hours. B. Every 4 hours. C. Every 6 hours. D. Once per shift. Answer: every 2 hours. Rationale: regular repositioning every 2 hours reduces pressure on the skin, improving circulation and preventing the formation of pressure ulcers. 26. What is the primary goal of patient education? A. To improve the nurse's teaching skills. B. To increase patient compliance with treatment. C. To make the nurse's workload easier. D. To decrease the patient's hospital stay. Answer: to increase patient compliance with treatment. Rationale: patient education aims to ensure that patients understand their health conditions and treatments, improving their ability to follow instructions and achieve better outcomes. 27. What is the correct way to verify patient identification before administering medication? A. Ask the patient to confirm their name. B. Check the patient's wristband against the medical record. C. Ask the patient's family for confirmation. D. Rely on the patient's room number. Answer: check the patient's wristband against the medical record. Rationale: the wristband provides the most accurate identification and helps avoid medication errors. Verifying with the medical record further ensures accuracy. 28. How should a nurse respond if a patient refuses medication? A. Force the patient to take the medication. B. Report the refusal and document the reason. C. Discard the medication immediately. D. Ignore the refusal. Answer: report the refusal and document the reason. Rationale: It's essential to document the patient's refusal to comply with treatment, ensuring a clear record and providing an opportunity to address concerns. 29. When obtaining a blood pressure measurement, which of the following could cause an inaccurate reading? A. Using a cuff that is too small for the patient's arm. B. Measuring blood pressure in the supine position. C. Placing the stethoscope over the brachial artery. D. Measuring blood pressure after the patient has rested for 5 minutes. Answer. Using a cuff that is too small for the patient's arm. Rationale. Using a cuff that is too small can result in falsely high blood pressure readings. The other actions contribute to accurate readings. 30. Which of the following is a priority nursing action for a patient receiving intravenous fluids? A. Monitor vital signs every 4 hours. B. Assess the foresight for signs of infiltration or infection. C. Ensure the patient is on a clear liquid diet. D. Administer pain medications regularly. Answer. Assess the foresight for signs of infiltration or infection. Rationale. Monitoring the foresight for complications such as infiltration or infection is critical to prevent further issues with fluid administration. 31. A patient is receiving an intravenous medication. What is the nurse's priority action? A. Check for signs of infiltration or extravasation. B. Ensure the patient is comfortable. C. Reassure the patient the medication is safe. D. Confirm the pump is working. Answer. Check for signs of infiltration or extravasation. Rationale. Ensuring that the foresight is not causing harm, infiltration or extravasation, is the most urgent priority to prevent complications like tissue damage. 32. Which of the following is considered a breach of patient confidentiality? A. Discussing a patient's condition with the healthcare team. B. Sharing patient information with family after consent is obtained. C. Leaving patient information on a visible computer screen. D. Documenting patient care in the medical record. Answer. Leaving patient information on a visible computer screen. Rationale. Leaving patient information visible is a breach of confidentiality and may lead to unauthorized access. 33. What is the correct action when taking a patient's temperature orally? A. Ensure the thermometer is placed in the patient's axilla. B. Wait at least 30 minutes after the patient drinks a cold beverage before taking the temperature. C. Place the thermometer under the patient's tongue and ask them to close their mouth. D. Take a temperature after the patient eats. Answer. Place the thermometer under the patient's tongue and ask them to close their mouth. Rationale. To obtain an accurate oral temperature, the thermometer should be placed under the tongue with the mouth closed to ensure proper reading. 34. What is the most important factor when assessing pain in a pediatric patient? A. Asking the parents to rate the pain. B. Using a standardized pain scale appropriate for the child's age. C. Administering medication first, then assessing pain. D. Observing the child's behavior. Answer. Using a standardized pain scale appropriate for the child's age. Rationale. Accurate assessment of pain requires using age-appropriate tools to understand the child's experience and guide intervention. 35. A nurse is planning care for a patient who is at risk for falls. What is an important intervention? A. Place a call light within the patient's reach. B. Encourage the patient to walk without assistance. C. Leave the patient's bed in the highest position for comfort. D. Provide the patient with unfamiliar footwear. Answer. Place a call light within the patient's reach. Rationale. Ensuring that the call light is within reach helps the patient alert staff for assistance, reducing the risk of falls. 36. When should a nurse perform hand hygiene? A. After providing patient care. B. Before and after eating. C. When entering and leaving a healthcare facility. D. All of the above. Answer. All of the above. Rationale. Hand hygiene is a critical practice in all of these situations to prevent the spread of infections. 37. What should a nurse do first when noticing that a patient's oxygen saturation level has dropped to 88%? A. Increase the oxygen flow rate. B. Call the physician immediately. C. Reposition the patient and assess respiratory status. D. Administer a pain medication. Answer: reposition the patient and assess respiratory status. Rationale: repositioning the patient can improve oxygenation by facilitating better lung expansion. Assessing respiratory status allows for further appropriate interventions. 38. What should a nurse do if a patient is found unresponsive? A. Perform a head tilt, chin lift maneuver. B. Call for help and begin CPR if necessary. C. Leave the room to call a rapid response. D. Administer oxygen immediately. Answer: call for help and begin CPR if necessary. Rationale: in an unresponsive patient, immediate action, including calling for help and starting CPR, is crucial for survival. 39. Which is the most accurate method for assessing a patient's core temperature? A. Oral thermometer. B. Rectal thermometer. C. Axillary thermometer. D. Tympanic thermometer. Answer: rectal thermometer. Rationale: a rectal thermometer provides the most accurate reading of core body temperature. 40. What is an appropriate nursing action when a patient is experiencing a seizure? A. Restrain the patient to prevent injury. B. Place a tongue depressor in the patient's mouth. C. Stay with the patient and protect them from injury. D. Offer the patient water after the seizure. Answer: stay with the patient and protect them from injury. Rationale: the priority during a seizure is to ensure the patient is safe and protected from injury. Restraint or inserting objects into the mouth can cause harm. 41. Which of the following is the best way to prevent the spread of infection in a healthcare setting? A. Washing hands before and after patient contact. B. Using hand sanitizer only when gloves are worn. C. Wearing a mask for all patients. D. Changing linens once a day. Answer: washing hands before and after patient contact. Rationale: hand hygiene is the most effective method for preventing the spread of infections in healthcare settings. 42. What is the first action a nurse should take when administering a medication to a patient? A. Verify the patient's allergies. B. Check the patient's identification. C. Explain the medication's side effects. D. Confirm the doctor's orders. Answer: check the patient's identification. Rationale: correct patient identification is the first step to prevent medication errors. 43. How should a nurse handle a situation where a patient expresses anxiety about a procedure? A. Ignore the patient's concerns to avoid distress. B. Reassure the patient without offering any explanations. C. Listen to the patient's concerns and provide appropriate information. D. Offer medications to calm the patient. Answer: listen to the patient's concerns and provide appropriate information. Rationale: addressing a patient's emotional concerns with appropriate information and reassurance helps reduce anxiety and promote a sense of control. 44. Which nursing intervention is most effective for managing a patient with chronic pain? A. Administering pain medication as prescribed. B. Encouraging deep breathing exercises. C. Providing distraction techniques. D. All of the above. Answer: all of the above. Rationale: chronic pain management involves a combination of interventions, including medication, relaxation, and distraction, to address both physical and emotional aspects of pain. 45. What is the appropriate action when a patient is receiving a blood transfusion and begins to show signs of a reaction? A. Continue the transfusion and monitor for further symptoms. B. Stop the transfusion and notify the healthcare provider. C. Administer a pain reliever. D. Change the patient's foresight. Answer: stop the transfusion and notify the healthcare provider. Rationale: immediate cessation of the transfusion is crucial when signs of a reaction appear to prevent further harm. 46. What is the most important consideration when planning care for a patient with a wound infection? A. Administer pain medication. B. Ensure adequate nutrition to support healing. C. Reposition the patient frequently. D. Provide emotional support. Answer: ensure adequate nutrition to support healing. Rationale: proper nutrition is essential to promote wound healing and prevent complications like further infection. 47. What should the nurse do if a patient has a history of allergies and is scheduled for a procedure requiring contrast dye? A. Administer an antihistamine before the procedure. B. Alert the physician and review the patient's allergy history. C. Proceed with the procedure as planned. D. Avoid administering any medications. Answer. Alert the physician and review the patient's allergy history. Rationale. Identifying potential allergic reactions before a procedure allows for appropriate preparation and prevention strategies. 48. How should a nurse position a patient in preparation for a lumbar puncture? A. Supine with the head elevated. B. Prone with the head turned to the side. C. Lying on their side with knees drawn to the chest. D. Sitting upright with legs dangling. Answer. Lying on their side with knees drawn to the chest. Rationale. This position helps open the spaces between vertebrae, making the procedure easier and safer. 49. Which of the following actions is most important for preventing a pressure ulcer? A. Repositioning the patient every 2 hours. B. Using a special bed to prevent pressure. C. Providing adequate hydration. D. Keeping the patient warm. Answer. Repositioning the patient every 2 hours. Rationale. Regular repositioning is one of the most effective ways to prevent pressure ulcers by reducing prolonged pressure on vulnerable areas. 50. What is the best way for a nurse to ensure a patient is informed about a new treatment plan? A. Give the patient a brochure about the treatment. B. Explain the plan in simple terms and answer any questions. C. Encourage the patient to ask the doctor about the plan. D. Schedule a follow-up visit to discuss the plan. Answer. Explain the plan in simple terms and answer any questions. Rationale. Clear communication between the nurse and patient ensures understanding of the treatment plan, improving compliance and satisfaction. 51. When documenting patient care, what is the most important guideline to follow? A. Use complete sentences to explain every action. B. Record only the positive aspects of the patient's progress. C. Document facts, not opinions or interpretations. D. Include personal feelings to show empathy. Answer. Document facts, not opinions or interpretations. Rationale. Documentation should be factual, objective, and accurate, avoiding personal interpretations or emotions. 52. A nurse is teaching a patient how to self-administer insulin. What is the most important aspect of the teaching process? A. Provide written instructions for reference. B. Ensure the patient demonstrates the procedure. C. Ask the family to assist with the injections. D. Use a model of the pancreas to demonstrate. Answer. Ensure the patient demonstrates the procedure. Rationale. The patient must demonstrate understanding of the technique to ensure they are capable of administering insulin safely. 53. A patient is receiving a blood transfusion and reports feeling chills. What is the nurse's first action? A. Stop the transfusion and notify the healthcare provider. B. Continue the transfusion and observe for further symptoms. C. Administer a pain reliever to the patient. D. Reassure the patient that chills are normal. Answer. Stop the transfusion and notify the healthcare provider. Rationale. Chills may indicate a transfusion reaction. The transfusion should be stopped immediately to prevent harm. 54. What is the most appropriate way to measure a patient's urine output? A. Record the amount the patient reports urinating. B. Estimate the amount of urine based on the color. C. Use a graduated container to measure urine. D. Measure the urine using a bedpan. Answer. Use a graduated container to measure urine. Rationale. A graduated container provides the most accurate measurement of urine output. 55. Which of the following is the most accurate description of a nurse's responsibility regarding informed consent? A. The nurse can sign the consent form as a witness. B. The nurse must explain the risks and benefits of the procedure. C. The nurse is responsible for obtaining the consent. D. The nurse should encourage the patient to sign the consent form. Answer. The nurse can sign the consent form as a witness. Rationale. The nurse's role is to witness the patient's signature and confirm that the patient understands the information given by the physician, not to explain the procedure. 56. A patient has an order for pain medication. What should the nurse do before administering the medication? A. Ask the patient to rate their pain. B. Check the patient's vital signs. C. Ensure the patient has eaten. D. Administer the medication without checking. Answer. Ask the patient to rate their pain. Rationale. It is important to assess the patient's pain level to evaluate the effectiveness of the medication later and ensure appropriate dosage. 57. When caring for a patient with a surgical wound, what is the primary nursing concern? A. Preventing infection. B. Managing pain. C. Maintaining patient privacy. D. Encouraging physical activity. Answer. Preventing infection. Rationale. The priority concern with a surgical wound is preventing infection, which could delay healing and cause further complications. 58. Which action should a nurse take to ensure a patient's privacy is maintained? A. Discuss the patient's condition only with family members. B. Close the door when performing assessments. C. Limit all patient care to only the attending physician. D. Share information with coworkers for better care coordination. Answer. Close the door when performing assessments. Rationale. Closing the door helps maintain privacy during assessments and reduces the risk of unauthorized individuals overhearing sensitive information. 59. A patient is at risk for falls. What is the most important preventive measure? A. Place the patient in a low-position bed. B. Use restraints to prevent movement. C. Make sure the call light is within the patient's reach. D. Encourage the patient to stay in bed at all times. Answer. Make sure the call light is within the patient's reach. Rationale. Ensuring that the call light is within the patient's reach allows them to call for assistance if needed, reducing the risk of falls. 60. A nurse is caring for a patient with a chest tube. What is the most important aspect of chest tube care? A. Keeping the chest tube and drainage system below the level of the patient's chest. B. Changing the chest tube dressing every 4 hours. C. Frequently irrigating the chest tube with saline. D. Administering pain medication before performing chest tube care. Answer. Keeping the chest tube and drainage system below the level of the patient's chest. Rationale. The chest tube and drainage system must be kept below the level of the chest to prevent backflow and promote proper drainage. 61. Which action is most important when a nurse is caring for a patient with a central venous catheter, CVC? A. Ensure the catheter is flushed regularly to prevent clotting. B. Remove the catheter as soon as possible. C. Apply pressure to the insertion site to prevent infection. D. Monitor for signs of infiltration at the insertion site. Answer. Ensure the catheter is flushed regularly to prevent clotting. Rationale. Regular flushing of a CVC helps prevent clot formation, ensuring proper function and reducing the risk of complications. 62. What is the primary responsibility of the nurse when caring for a patient with a wound? A. Change the dressing every 2 hours. B. Assess the wound for signs of infection and promote healing. C. Provide the patient with antibiotics. D. Encourage the patient to rest the wound area. Answer. Assess the wound for signs of infection and promote healing. Rationale. Regular assessment of the wound for infection signs and promoting optimal healing through appropriate care are critical for preventing complications. 63. A patient is receiving a medication that could potentially cause drowsiness. What is the nurse's priority action? A. Encourage the patient to stay active. B. Assess the patient's level of alertness regularly. C. Limit fluid intake to prevent frequent urination. D. Offer caffeine to the patient to counteract drowsiness. Answer. Assess the patient's level of alertness regularly. Rationale. Monitoring the patient's alertness is important to detect any adverse effects and ensure patient safety, especially with medications that can cause drowsiness. 64. What is the primary role of the nurse when providing patient care for someone undergoing a diagnostic procedure? A. Administer medications prior to the procedure. B. Explain the procedure in detail. C. Ensure the patient is adequately prepared for the procedure. D. Perform the procedure under the physician's supervision. Answer. Ensure the patient is adequately prepared for the procedure. Rationale. The nurse ensures that the patient is prepared physically and psychologically for the procedure, such as ensuring fasting or informed consent. 65. What should a nurse do if a patient suddenly becomes short of breath while lying down? A. Help the patient sit up to assist with breathing. B. Administer oxygen immediately. C. Notify the healthcare provider. D. Reassure the patient and wait for symptoms to improve. Answer. Help the patient sit up to assist with breathing. Rationale. Sitting up can help improve respiratory effort and ease the patient's shortness of breath. If symptoms persist, further interventions, such as oxygen, may be needed. 66. A nurse is teaching a patient about the importance of daily exercise. Which of the following should be included in the teaching plan? A. Exercise should be done only under the supervision of a healthcare provider. B. Physical activity is important for maintaining muscle strength and cardiovascular health. C. Exercise can be avoided if the patient feels tired. D. Only high-intensity exercises are beneficial. Answer. Physical activity is important for maintaining muscle strength and cardiovascular health. Rationale. Regular exercise helps improve overall health by maintaining strength, mobility, and cardiovascular health. 67. When providing care for a patient with a nasogastric NG tube, what should the nurse do first before administration of feedings? A. Check the patient's temperature. B. Verify placement of the NG tube. C. Flush the NG tube with saline. D. Check the patient's blood pressure. Answer. Verify placement of the NG tube. Rationale. Verifying the correct placement of the NG tube ensures that the feeding is delivered to the stomach and not into the lungs, preventing aspiration. 68. What is the most important consideration when transferring a patient from bed to a wheelchair? A. Ensure the patient is comfortable. B. Confirm that the wheelchair is locked. C. Provide the patient with a pillow for support. D. Move the patient quickly to reduce fatigue. Answer. Confirm that the wheelchair is locked. Rationale. Ensuring that the wheelchair is locked before transferring the patient is crucial for safety. 69. A nurse is administering medication through a gastrostomy tube. What is the most important step in this process? A. Crush the medication and mix with water. B. Ensure the tube is patent and flush with water before and after administration. C. Mix the medication with the patient's food. D. Administer all medications at once. Answer. Ensure the tube is patent and flush with water before and after administration. Rationale. Flushing the tube ensures it is patent and prevents clogging. 70. A nurse is caring for a patient with an oxygen mask. What should the nurse monitor regularly? A. The patient's blood pressure. B. The patient's respiratory rate and oxygen saturation levels. C. The patient's pulse. D. The patient's body temperature. Answer. The patient's respiratory rate and oxygen saturation levels. Rationale. Monitoring respiratory status and oxygen levels is critical to ensure the patient is receiving adequate oxygenation. 71. What is the priority action when a patient has an allergic reaction to a medication? A. Administer antihistamines immediately. B. Notify the healthcare provider and assess the patient. C. Continue administering the medication. D. Offer the patient fluids to flush out the medication. Answer. Notify the healthcare provider and assess the patient. Rationale. The first step is to assess the patient's symptoms and notify the healthcare provider for appropriate intervention. 72. How should the nurse care for a patient receiving parenteral nutrition? A. Monitor the infusion site for signs of infection or irritation. B. Ensure the patient is eating orally at the same time. C. Limit the patient's fluid intake. D. Change the infusion site every 12 hours. Answer. Monitor the infusion site for signs of infection or irritation. Rationale. Parenteral nutrition requires close monitoring of the infusion site to detect any complications such as infection or infiltration. 73. A nurse is assessing a patient's pain level. What is the most effective way to assess pain? A. Ask the patient to describe the type of pain. B. Use a numerical pain scale. C. Observe the patient's facial expression. D. Ask the family members about the patient's pain. Answer. Use a numerical pain scale. Rationale. A numerical pain scale provides a standardized way to assess pain and allows for better communication between the nurse and the patient. 74. A patient has a nasogastric NG tube for gastric decompression. What is the most important aspect of nursing care for this patient? A. Monitor the patient's weight. B. Maintain the NG tube's patency. C. Administer pain medications. D. Encourage the patient to eat and drink. Answer. Maintain the NG tube's patency. Rationale. The NG tube must remain patent to allow for effective drainage and prevent complications such as aspiration or obstruction. 75. Which of the following is the best approach when providing end-of-life care for a patient? A. Offer comfort and support to both the patient and the family. B. Focus on curative treatment options. C. Encourage the patient to discuss their death openly. D. Minimize contact with the patient to respect privacy. Answer. Offer comfort and support to both the patient and the family. Rationale. Providing comfort and emotional support is crucial in end-of-life care, addressing the patient's and family's emotional, psychological, and physical needs. 76. A patient is being discharged with a prescription for anticoagulants. What is the nurse's priority teaching point? A. Teach the patient about the importance of follow-up blood tests. B. Instruct the patient to avoid physical activity. C. Discuss the importance of dietary restrictions. D. Tell the patient to stop the medication if they experience side effects. Answer. Teach the patient about the importance of follow-up blood tests. Rationale. Anticoagulants require regular monitoring to assess the patient's response to the medication and prevent bleeding complications. 77. What is the most appropriate action for a nurse when observing a patient who is demonstrating signs of agitation and confusion? A. Provide a calming environment and reassure the patient. B. Ask the patient to focus on a specific task. C. Ignore the signs, as they are normal in elderly patients. D. Restrict the patient's movements to prevent harm. Answer. Provide a calming environment and reassure the patient. Rationale. A calm environment and reassurance can help reduce anxiety and confusion, especially in patients who are agitated. 78. What is the priority nursing action when a patient develops a pressure ulcer? A. Apply a sterile dressing to the ulcer. B. Assess the size, depth, and condition of the ulcer. C. Notify the healthcare provider. D. Encourage the patient to eat high-protein foods. Answer. Assess the size, depth, and condition of the ulcer. Rationale. The nurse must assess the wound to determine its severity and plan appropriate treatment to prevent further complications. 79. What should the nurse include in the teaching plan for a patient with hypertension? A. Restrict fluid intake to reduce blood pressure. B. Emphasize the importance of adhering to prescribed medications and lifestyle changes. C. Recommend that the patient avoid physical activity. D. Teach the patient to monitor blood sugar levels. Answer. Emphasize the importance of adhering to prescribed medications and lifestyle changes. Rationale. Adherence to medications and lifestyle modifications, including diet, exercise, and stress management, is key in managing hypertension. 80. A nurse is performing a health assessment on an elderly patient. What is an important consideration during the assessment? A. Use a straightforward, non-empathetic approach. B. Focus on the patient's functional ability and safety. C. Minimize the time spent on assessment to avoid fatigue. D. Encourage the patient to speak only when asked specific questions. Answer. Focus on the patient's functional ability and safety. Rationale. Elderly patients may have specific needs related to functional ability and safety, so these should be prioritized during the assessment. 81. A patient is experiencing difficulty swallowing. What should the nurse do first? A. Encourage the patient to drink more fluids. B. Notify the healthcare provider immediately. C. Place the patient on a soft diet. D. Assess the patient's gag reflex and ability to swallow. Answer. Assess the patient's gag reflex and ability to swallow. Rationale. Assessing the patient's swallowing ability is essential to ensure safe feeding and prevent aspiration or choking. 82. Which of the following is a nurse's priority action when caring for a patient receiving a blood transfusion? A. Monitor the patient for signs of a transfusion reaction. B. Provide comfort measures and emotional support. C. Ensure the patient is eating well during the transfusion. D. Assess the patient's urine output. Answer. Monitor the patient for signs of a transfusion reaction. Rationale. Transfusion reactions can occur, and immediate monitoring for signs such as fever, chills, or rash is essential to ensure patient safety. 83. When should a nurse apply a dressing to a wound? A. After cleaning the wound and ensuring it is free from infection. B. Before cleaning the wound to prevent contamination. C. After applying an antibiotic ointment. D. Immediately after the wound is assessed. Answer. After cleaning the wound and ensuring it is free from infection. Rationale. The wound should be cleaned and assessed for infection before applying a dressing to prevent further contamination and promote healing. 84. What is the priority nursing action when a patient is experiencing a seizure? A. Place the patient in a prone position to prevent aspiration. B. Protect the patient from injury and maintain airway patency. C. Restrain the patient's movements to prevent harm. D. Immediately administer an anticonvulsant medication. Answer. Protect the patient from injury and maintain airway patency. Rationale. Ensuring safety and airway patency is crucial during a seizure to prevent injury and maintain oxygenation. 85. What is the nurse's role in administering a medication through a patient's intravenous line? A. Ensure the correct medication, dose, and patient identification before administration. B. Administer the medication as soon as it is ordered, regardless of the patient's condition. C. Skip the verification process to save time. D. Verify the medication dose only with the healthcare provider. Answer. Ensure the correct medication, dose, and patient identification before administration. Rationale. Correct medication administration is essential to ensure patient safety, including verification of the medication, dose, and patient. 86. A patient is being discharged with a prescription for an opioid. What should the nurse teach the patient about potential side effects? A. It is important to report dizziness or confusion to the healthcare provider. B. Opioids are safe to use long-term without side effects. C. Avoid reporting any mild side effects unless they are severe. D. The patient should avoid drinking water while on opioids. Answer. It is important to report dizziness or confusion to the healthcare provider. Rationale. Opioids can cause side effects such as dizziness, confusion, or respiratory depression, which should be reported immediately to prevent complications. 87. What is the most important nursing intervention for a patient with respiratory distress? A. Encourage the patient to take deep breaths. B. Administer oxygen therapy as ordered. C. Position the patient in a side-lying position. D. Increase fluid intake to thin secretions. Answer. Administer oxygen therapy as ordered. Rationale. Oxygen therapy helps improve oxygenation and relieve respiratory distress, which is the primary concern in these patients. 88. A patient has a prescription for a diuretic medication. What should the nurse monitor regularly? A. The patient's blood pressure and electrolytes. B. The patient's appetite and weight. C. The patient's temperature and pulse. D. The patient's skin condition. Answer. The patient's blood pressure and electrolytes. Rationale. Diuretics can affect fluid balance and electrolyte levels, making it important to monitor these parameters regularly. 89. A nurse is caring for a patient who has undergone surgery. What should the nurse prioritize during the postoperative phase? A. Monitoring vital signs and pain levels. B. Encouraging the patient to get out of bed immediately. C. Offering the patient food and fluids right away. D. Minimizing communication with the patient. Answer: monitoring vital signs and pain levels. Rationale: after surgery, monitoring the patient's vital signs and managing pain are priorities to detect complications and promote recovery. 90. A nurse is performing a physical assessment on a patient. What is the best approach to ensure accuracy? A. Focus on one area of the body at a time. B. Begin with a general inspection of the patient's appearance. C. Conduct the assessment in a rushed manner to save time. D. Ask the patient to perform physical activities during the assessment. Answer: begin with a general inspection of the patient's appearance. Rationale: starting with a general inspection provides a broad overview of the patient's condition and helps focus further assessment. 91. What should the nurse do first when caring for a patient with a catheter? A. Change the catheter every 12 hours. B. Ensure the catheter is properly secured to prevent tugging. C. Encourage the patient to drink large amounts of fluids. D. Remove the catheter as soon as possible. Answer: ensure the catheter is properly secured to prevent tugging. Rationale: proper securing of the catheter prevents discomfort, injury, and the risk of dislodgement. 92. A nurse is caring for a patient with a wound infection. What is the most important intervention? A. Administer antibiotics as prescribed. B. Keep the wound dry at all times. C. Change the wound dressing only once per day. D. Limit the patient's fluid intake to prevent infection. Answer: administer antibiotics as prescribed. Rationale: antibiotics are the primary treatment for infection, and timely administration is crucial for successful recovery. 93. What is the nurse's role when a patient is receiving a blood transfusion? A. Ensure the correct blood type and patient identification before administering the transfusion. B. Begin the transfusion without verifying the blood type to save time. C. Skip monitoring the patient during the transfusion. D. Limit communication with the patient during the procedure. Answer: ensure the correct blood type and patient identification before administering the transfusion. Rationale: proper verification of blood type and patient identity is crucial to prevent transfusion reactions and ensure patient safety. 94. A nurse is caring for a patient with a chest tube. What should the nurse monitor regularly? A. The amount of drainage and the patient's respiratory status. B. The patient's temperature and pulse. C. The patient's fluid intake and output. D. The patient's level of consciousness. Answer: the amount of drainage and the patient's respiratory status. Rationale: monitoring chest tube drainage and respiratory status helps assess the effectiveness of the tube and detect potential complications. 95. A patient is diagnosed with hypovolemia. What is the priority nursing intervention? A. Administer intravenous fluids as prescribed. B. Encourage the patient to eat high-salt foods. C. Restrict fluid intake to prevent overload. D. Provide a low-sodium diet. Answer: administer intravenous fluids as prescribed. Rationale: hypovolemia requires prompt fluid replacement to restore blood volume and prevent shock. 96. A nurse is caring for a patient with a wound infection. What is the most important intervention? A. Administer antibiotics as prescribed. B. Keep the wound dry at all times. C. Change the wound dressing only once per day. D. Limit the patient's fluid intake to prevent infection. Answer: administer antibiotics as prescribed. Rationale: antibiotics are crucial for treating infection, and timely administration can help prevent further complications. 97. A patient is being discharged with instructions to monitor blood pressure at home. What should the nurse emphasize? A. Measure blood pressure at the same time each day. B. Measure blood pressure only when feeling unwell. C. Limit the number of readings to once a week. D. Avoid keeping a record of the readings. Answer: measure blood pressure at the same time each day. Rationale: measuring blood pressure consistently at the same time each day ensures accurate tracking of trends and helps in managing hypertension effectively. 98. What is the nurse's priority intervention for a patient who is experiencing a seizure? A. Restrain the patient to prevent injury. B. Place the patient in a prone position. C. Protect the patient from injury and maintain airway patency. D. Administer an anticonvulsant immediately. Answer: protect the patient from injury and maintain airway patency. Rationale: the nurse should ensure the patient's safety and maintain airway patency to prevent injury and facilitate oxygenation during a seizure. 99. A patient is receiving an opioid for pain management. What is the most important nursing action? A. Monitor the patient for signs of respiratory depression. B. Ensure the patient is eating enough food. C. Encourage the patient to walk frequently. D. Administer a mild sedative to prevent agitation. Answer: monitor the patient for signs of respiratory depression. Rationale: opioids can cause respiratory depression, which requires close monitoring to prevent complications such as hypoxia or respiratory arrest. 100. A patient is prescribed a medication for hyperthyroidism. What should the nurse monitor closely? A. The patient's blood pressure and heart rate. B. The patient's blood glucose levels. C. The patient's cholesterol levels. D. The patient's electrolyte balance. Answer: the patient's blood pressure and heart rate. Rationale: hyperthyroidism affects the cardiovascular system, so the nurse should closely monitor blood pressure and heart rate for signs of tachycardia or hypertension. 101. A nurse is caring for a patient who is recovering from surgery. What is the most important nursing action during the immediate postoperative phase? A. Encourage the patient to ambulate as soon as possible. B. Administer pain medications as prescribed. C. Monitor vital signs and assess the surgical site. D. Offer the patient solid food and fluids immediately. Answer: monitor vital signs and assess the surgical site. Rationale: in the immediate postoperative phase, monitoring vital signs and assessing the surgical site for complications, e.g., bleeding, infection, is critical. 102. What is the most important aspect of care for a patient with a hip fracture? A. Provide pain management and prevent further injury. B. Encourage the patient to exercise the affected leg. C. Restrict fluid intake to prevent swelling. D. Apply heat to the affected area. Answer: provide pain management and prevent further injury. Rationale: pain management and preventing further injury are the top priorities for patients with hip fractures to promote healing and reduce discomfort. 103. A nurse is caring for a patient with a urinary catheter. What is the most important action to prevent infection? A. Clean the area around the catheter with antiseptic daily. B. Keep the catheter drainage bag above the level of the bladder. C. Ensure the catheter is securely taped to the patient's leg. D. Change the catheter every 24 hours. Answer: clean the area around the catheter with antiseptic daily. Rationale: daily cleaning of the catheter site helps prevent infection by reducing the growth of bacteria at the insertion site. 104. What is the best approach for a nurse to take when caring for a patient with dementia? A. Use simple, clear language and maintain consistency in care. B. Encourage the patient to make decisions independently. C. Restrict family visits to avoid confusion. D. Stimulate the patient with complex tasks to improve cognitive function. Answer: use simple, clear language and maintain consistency in care. Rationale: patients with dementia benefit from simple instructions, clear communication, and consistent routines to minimize confusion and promote their sense of security. 105. A nurse is providing discharge instructions to a patient who has just had a colostomy. What should the nurse include in the teaching plan? A. Encourage the patient to avoid foods that may cause gas. B. Advise the patient to avoid all physical activity for 6 weeks. C. Instruct the patient to avoid showering or bathing. D. Suggest that the patient clean the stoma with soap and water daily. Answer: encourage the patient to avoid foods that may cause gas. Rationale: certain foods may cause gas and bloating, which can be uncomfortable for patients with colostomies. The nurse should also provide information on proper care of the stoma. 106. A nurse is caring for a patient who is receiving 4 fluids. What is the priority nursing action? A. Monitor the patient's fluid intake and output. B. Increase the flow rate of 4 fluids. C. Administer pain medication before starting the 4. D. Encourage the patient to drink additional fluids. Answer: monitor the patient's fluid intake and output. Rationale: monitoring fluid intake and output ensures proper hydration status and identifies any fluid imbalances, especially with IV therapy. 107. A nurse is caring for a patient with an indwelling urinary catheter. What is an important consideration for preventing catheter-associated urinary tract infections, CAUTIs? A. Ensure the catheter is inserted using sterile technique. B. Change the catheter every 12 hours. C. Keep the catheter drainage bag above the bladder. D. Encourage the patient to drink large amounts of fluid. Answer: ensure the catheter is inserted using sterile technique. Rationale: the primary measure to prevent CAUTIs is the use of sterile technique during catheter insertion to reduce the risk of introducing bacteria into the urinary system. 108. A nurse is caring for a patient with a draining wound. What should the nurse do to prevent infection? A. Clean the wound with hydrogen peroxide. B. Apply a sterile dressing to the wound. C. Leave the wound open to air to promote healing. D. Massage the wound gently to promote circulation. Answer: apply a sterile dressing to the wound. Rationale: a sterile dressing helps protect the wound from infection, absorb drainage, and maintain a moist healing environment. 109. A patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with respiratory distress. What is the nurse's priority action? A. Administer oxygen as ordered. B. Encourage the patient to cough and deep breathe. C. Increase the patient's fluid intake. D. Place the patient in a supine position to promote lung expansion. Answer: administer oxygen as ordered. Rationale: oxygen therapy is a priority in managing respiratory distress to improve oxygenation and prevent further complications. 110. A nurse is preparing to discharge a patient with heart failure. What is the most important teaching point for the nurse to include? A. Encourage the patient to avoid salt and high-sodium foods. B. Advise the patient to rest in bed for long periods. C. Instruct the patient to take potassium supplements. D. Limit fluid intake to prevent dehydration. Answer: encourage the patient to avoid salt and high-sodium foods. Rationale: a low-sodium diet is essential for managing heart failure and preventing fluid retention, which can exacerbate the condition. 111. A nurse is caring for a patient with deep vein thrombosis, DVT. What should the nurse monitor closely? A. Signs of pulmonary embolism. B. Blood glucose levels. C. Blood pressure and heart rate. D. Fluid intake and output. Answer: signs of pulmonary embolism. Rationale: DVT can lead to a pulmonary embolism if the clot dislodges, so it is crucial to monitor for symptoms such as chest pain, shortness of breath, and tachycardia. 112. A nurse is caring for a patient who has just undergone a lumbar puncture. What is the most important nursing action? A. Encourage the patient to lie flat for several hours. B. Instruct the patient to take deep breaths to relax. C. Assess the patient for any signs of respiratory distress. D. Administer pain medications immediately. Answer: encourage the patient to lie flat for several hours. Rationale: lying flat helps prevent post-procedure complications such as headache or CSF leakage after a lumbar puncture. 113. A nurse is providing instructions to a patient with diabetes mellitus. What should the nurse include in the teaching plan? A. Teach the patient how to monitor blood glucose levels. B. Encourage the patient to skip meals to reduce blood sugar. C. Advise the patient to avoid physical activity. D. Instruct the patient to take insulin only when feeling ill. Answer: teach the patient how to monitor blood glucose levels. Rationale: Monitoring blood glucose levels is essential for managing diabetes and adjusting treatment as necessary to prevent complications. 114. A nurse is caring for a patient with a fracture. What is the most important intervention to prevent complications? A. Apply a splint and elevate the affected limb. B. Administer pain medications. C. Encourage the patient to ambulate frequently. D. Monitor for signs of infection at the fracture site. Answer. Apply a splint and elevate the affected limb. Rationale. Applying a splint and elevating the limb helps reduce swelling and prevent further injury, which are key in the management of fractures. 115. A patient is prescribed a potassium-sparing diuretic. What should the nurse monitor closely? A. Serum potassium levels. B. Blood pressure. C. Heart rate. D. Serum calcium levels. Answer. Serum potassium levels. Rationale. Potassium-sparing diuretics can cause hyperkalemia, so monitoring serum potassium levels is essential to prevent dangerous arrhythmias or cardiac issues. 116. A nurse is caring for a patient with an asthma attack. What is the priority action? A. Administer a bronchodilator as prescribed. B. Encourage the patient to rest. C. Provide oxygen therapy as prescribed. D. Monitor blood glucose levels. Answer. Administer a bronchodilator as prescribed. Rationale. A bronchodilator is the priority treatment for relieving bronchospasm during an asthma attack, allowing improved airflow to the lungs. 117. A nurse is caring for a patient with chronic renal failure. What is the most important intervention to prevent complications? A. Monitor the patient's electrolyte levels. B. Encourage the patient to take vitamin supplements. C. Promote fluid retention. D. Avoid using nephrotoxic medications. Answer. Monitor the patient's electrolyte levels. Rationale. Chronic renal failure affects the kidney's ability to balance electrolytes, so regular monitoring is important to avoid complications, such as hyperkalemia or hypocalcemia. 118. A patient is diagnosed with hypercalcemia. What is the nurse's priority intervention? A. Increase fluid intake and encourage ambulation. B. Administer a calcium supplement. C. Restrict fluid intake to prevent overload. D. Encourage the patient to avoid physical activity. Answer. Increase fluid intake and encourage ambulation. Rationale. Increasing fluid intake and promoting ambulation help reduce calcium levels by preventing kidney stones and promoting calcium excretion. 119. A nurse is caring for a patient with a nasogastric tube. What is the most important nursing action? A. Ensure the tube is securely placed and functionally clear. B. Administer nutrition through the tube every 4 hours. C. Maintain the patient's position in a supine position. D. Monitor for signs of hypoglycemia. Answer. Ensure the tube is securely placed and functionally clear. Rationale. Ensuring the nasogastric tube is secure and functioning properly reduces the risk of complications, such as aspiration or tube displacement. 120. A patient is receiving chemotherapy for cancer. What should the nurse monitor closely? A. White blood cell count. B. Blood glucose levels. C. Heart rate and blood pressure. D. Serum calcium levels. Answer. White blood cell count. Rationale. Chemotherapy can suppress bone marrow production, which affects white blood cell counts and increases the risk of infection. Regular monitoring is essential to detect neutropenia. 121. A nurse is caring for a patient with a history of peptic ulcer disease. What is the priority intervention? A. Encourage the patient to take antacids after meals. B. Administer proton pump inhibitors as prescribed. C. Limit the patient's fluid intake. D. Encourage the patient to lie down after eating. Answer. Administer proton pump inhibitors as prescribed. Rationale. Proton pump inhibitors reduce gastric acid production, which helps heal ulcers and prevent further damage. 122. A nurse is caring for a patient with a history of heart failure. What should the nurse monitor closely? A. Serum glucose levels. B. Oxygen saturation levels. C. Serum sodium levels. D. Blood pressure. Answer: oxygen saturation levels. Rationale: patients with heart failure are at risk for impaired oxygenation due to fluid buildup in the lungs, so oxygen saturation should be monitored closely. 123. A nurse is caring for a patient with a diagnosis of deep vein thrombosis, DVT. What is the priority intervention? A. Apply a warm compress to the affected leg. B. Elevate the affected leg. C. Administer anticoagulants as prescribed. D. Massage the affected leg to promote circulation. Answer: administer anticoagulants as prescribed. Rationale: anticoagulants are crucial in preventing the clot from growing or breaking off, which could lead to a pulmonary embolism. 124. A nurse is caring for a patient with a nasogastric tube. What is the most important nursing action? A. Ensure the tube is securely placed and functionally clear. B. Administer nutrition through the tube every 4 hours. C. Maintain the patient's position in a supine position. D. Monitor for signs of hypoglycemia. Answer: ensure the tube is securely placed and functionally clear. Rationale: ensuring the nasogastric tube is secure and functioning properly reduces the risk of complications, such as aspiration or tube displacement. 125. A patient is receiving chemotherapy for cancer. What should the nurse monitor closely? A. White blood cell count. B. Blood glucose levels. C. Heart rate and blood pressure. D. Serum calcium levels. Answer: white blood cell count. Rationale: chemotherapy can suppress bone marrow production, which affects white blood cell counts and increases the risk of infection. Regular monitoring is essential to detect neutropenia. 126. A nurse is caring for a patient with chronic kidney disease. What is the priority intervention? A. Restrict fluid intake. B. Monitor for signs of infection. C. Administer medications as prescribed. D. Monitor serum potassium levels. Answer: monitor serum potassium levels. Rationale: kidney disease can lead to potassium retention, which increases the risk of hyperkalemia and arrhythmias, making potassium monitoring a priority. 127. A nurse is caring for a patient with pneumonia. What is the most important nursing intervention? A. Administer antibiotics as prescribed. B. Encourage fluid intake. C. Promote coughing and deep breathing exercises. D. Provide supplemental oxygen as prescribed. Answer: administer antibiotics as prescribed. Rationale: antibiotics are essential for treating bacterial pneumonia, and initiating the prescribed therapy helps reduce infection and prevent complications. 128. A nurse is caring for a patient who is experiencing acute pain from a surgical incision. What should the nurse administer first? A. A nonsteroidal anti-inflammatory drug NSAID. B. A narcotic analgesic as prescribed. C. A muscle relaxant. D. A local anesthetic. Answer: a narcotic analgesic as prescribed. Rationale: narcotic analgesics provide stronger pain relief for acute surgical pain and are often the first-line treatment for managing postoperative pain. 129. A nurse is caring for a patient with a severe allergic reaction. What is the priority action? A. Administer antihistamines as prescribed. B. Administer oxygen therapy as prescribed. C. Administer epinephrine as prescribed. D. Apply a cold compress to the affected area. Answer: administer epinephrine as prescribed. Rationale: epinephrine is the first-line treatment for anaphylaxis as it works quickly to counteract the life-threatening effects of severe allergic reactions. 130. A nurse is caring for a patient with a history of asthma. What should the nurse monitor during an asthma attack? A. Respiratory rate and oxygen saturation. B. Blood pressure and heart rate. C. Serum sodium levels. D. Urinary output. Answer: respiratory rate and oxygen saturation. Rationale: during an asthma attack, the airway becomes constricted, making it important to monitor the respiratory rate and oxygen levels to ensure adequate oxygenation. 131. A nurse is caring for a patient who is receiving 4 fluids at a rapid rate. What is the priority assessment? A. Monitor the patient's blood pressure and heart rate. B. Monitor the patient's electrolyte levels. C. Assess for signs of fluid overload. D. Assess the foresight for signs of infection. Answer. Assess for signs of fluid overload. Rationale. Rapid 4-fluid administration increases the risk of fluid overload, leading to complications such as pulmonary edema. 132. A nurse is caring for a patient with diabetes mellitus. What is the priority action to prevent complications? A. Monitor blood glucose levels regularly. B. Encourage a high-protein diet. C. Restrict the patient's fluid intake. D. Administer insulin as prescribed. Answer. Monitor blood glucose levels regularly. Rationale. Regular blood glucose monitoring helps detect hyperglycemia or hypoglycemia, enabling timely interventions to prevent complications. 133. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. What is the most important intervention? A. Administer bronchodilators as prescribed. B. Encourage coughing and deep breathing exercises. C. Encourage fluid intake. D. Administer oxygen as prescribed. Answer. Administer bronchodilators as prescribed. Rationale. Bronchodilators are essential in COPD to open the airways and improve airflow, reducing symptoms such as wheezing and shortness of breath. 134. A nurse is caring for a patient with a history of hypertension. What is the priority nursing intervention? A. Monitor blood pressure regularly. B. Educate the patient on low-fat diet choices. C. Restrict fluid intake. D. Administer diuretics as prescribed. Answer. Monitor blood pressure regularly. Rationale. Regular blood pressure monitoring is critical in managing hypertension, allowing for early detection of uncontrolled blood pressure and adjusting treatment as needed. 135. A nurse is caring for a patient with a newly diagnosed myocardial infarction, MI. What is the priority intervention? A. Administer oxygen therapy as prescribed. B. Monitor the patient's blood pressure and heart rate. C. Administer nitroglycerin as prescribed. D. Provide pain relief as prescribed. Answer. Administer oxygen therapy as prescribed. Rationale. Oxygen therapy helps improve oxygen supply to the heart tissue, which is vital in the early management of an MI to prevent further damage to the heart muscle. 136. A nurse is caring for a patient with a diagnosis of depression. What is the priority nursing intervention? A. Encourage the patient to engage in social activities. B. Administer antidepressant medications as prescribed. C. Monitor the patient for suicidal thoughts. D. Encourage the patient to rest in bed. Answer. Monitor the patient for suicidal thoughts. Rationale. The priority in caring for a patient with depression is assessing and preventing suicide risk, as this can be a life-threatening concern. 137. A nurse is caring for a child with a fever. What is the first action to take? A. Administer antipyretics as prescribed. B. Measure the child's temperature regularly. C. Encourage the child to drink fluids. D. Provide a cool bath. Answer. Administer antipyretics as prescribed. Rationale. Administering antipyretics will help lower the fever and provide relief, especially if the fever is high or causing discomfort. 138. A nurse is caring for a patient receiving intravenous 4 antibiotics. What is the priority nursing action? A. Assess the foresight for signs of infiltration. B. Monitor the patient's blood pressure and temperature. C. Ensure the 4 antibiotic is infused at the prescribed rate. D. Encourage the patient to drink fluids. Answer. Assess the foresight for signs of infiltration. Rationale. Ensuring that the foresight is patent and free of complications like infiltration is a priority to prevent further complications from the 4 infusion. 139. A nurse is caring for a patient with chronic pain. What is the most important aspect of pain management? A. Provide regular pain assessments and adjust medications as needed. B. Encourage the patient to rest as much as possible. C. Offer relaxation techniques and guided imagery. D. Administer pain medications every 4 hours, regardless of pain. Answer. Provide regular pain assessments and adjust medications as needed. Rationale. Regular assessment and adjustment of pain management interventions are essential to address the patient's pain level effectively. 140. A nurse is caring for a patient recovering from surgery. What is the most important intervention to prevent post-operative complications? A. Encourage deep breathing and coughing exercises. B. Monitor the patient's oxygen saturation levels. C. Administer pain medications as prescribed. D. Assess the surgical site for signs of infection. Answer. Encourage deep breathing and coughing exercises. Rationale. Deep breathing and coughing exercises help prevent atelectasis and pneumonia, common post-operative complications. 141. A nurse is caring for a patient with hypertension. What should the nurse educate the patient about to help manage the condition? A. Limiting sodium intake and maintaining a healthy weight. B. Taking antihistamines regularly. C. Drinking more caffeine to increase blood pressure. D. Restricting fluid intake to reduce the workload on the heart. Answer. Limiting sodium intake and maintaining a healthy weight. Rationale. Reducing sodium intake and maintaining a healthy weight are crucial lifestyle changes to manage hypertension effectively. 142. A nurse is caring for a patient with a history of strokes. What is the priority nursing intervention? A. Monitor for signs of a recurrent stroke. B. Encourage the patient to exercise regularly. C. Administer antihypertensive medications as prescribed. D. Ensure the patient is following a low-sodium diet. Answer. Monitor for signs of a recurrent stroke. Rationale. Patients with a history of strokes are at high risk for recurrent strokes, so early detection and intervention are crucial. 143. A nurse is caring for a patient with a history of chronic alcoholism. What is the priority intervention? A. Monitor for signs of alcohol withdrawal. B. Encourage the patient to attend support groups. C. Administer sedatives to prevent withdrawal symptoms. D. Provide a high-calorie diet. Answer. Monitor for signs of alcohol withdrawal. Rationale. Alcohol withdrawal can be life-threatening, so monitoring for early signs and symptoms of withdrawal is critical for patient safety. 144. A nurse is caring for a patient with a history of asthma. What is the most important intervention during an asthma attack? A. Administer a bronchodilator as prescribed. B. Encourage the patient to rest. C. Monitor the patient's blood pressure. D. Administer corticosteroids as prescribed. Answer. Administer a bronchodilator as prescribed. Rationale. Bronchodilators provide quick relief by relaxing the airway muscles and improving airflow during an asthma attack. 145. A nurse is caring for a patient receiving morphine for pain management. What is the priority nursing assessment? A. Monitor for signs of respiratory depression. B. Assess the patient's appetite and fluid intake. C. Monitor for signs of hyperglycemia. D. Encourage the patient to eat a high-fiber diet. Answer. Monitor for signs of respiratory depression. Rationale. Morphine can cause respiratory depression, which can be life-threatening, so it is important to closely monitor respiratory status. 146. A nurse is caring for a patient with a history of diabetes. What is the priority intervention? A. Monitor blood glucose levels regularly. B. Administer insulin as prescribed. C. Encourage a balanced diet. D. Educate the patient on proper foot care. Answer. Monitor blood glucose levels regularly. Rationale. Monitoring blood glucose levels is crucial to managing diabetes and preventing complications such as hypoglycemia or hyperglycemia. 147. A nurse is caring for a patient with a history of stroke. What is the priority intervention? A. Monitor the patient's neurological status. B. Encourage the patient to perform physical therapy. C. Administer aspirin as prescribed. D. Provide a low-salt diet. Answer. Monitor the patient's neurological status. Rationale. Stroke patients are at risk for neurological changes, and regular assessment helps identify any new deficits or complications early. 148. A nurse is caring for a patient with a history of chronic alcoholism. What is the priority nursing intervention? A. Administer vitamin B complex as prescribed. B. Monitor for signs of delirium tremens. C. Encourage the patient to attend alcohol counseling. D. Encourage the patient to increase fluid intake. Answer. Monitor for signs of delirium tremens. Rationale. Delirium tremens is a life-threatening complication of alcohol withdrawal and requires immediate attention. 149. A nurse is caring for a patient with a history of asthma. What should the nurse instruct the patient to do in case of an asthma attack? A. Take 2 puffs of the rescue inhaler and wait for relief. B. Lie down and rest until symptoms subside. C. Take deep breaths and hold for 10 seconds. D. Take the prescribed long-acting bronchodilator immediately. Answer. Take 2 puffs of the rescue inhaler and wait for relief. Rationale. The rescue inhaler provides quick relief during an asthma attack by opening the airways. 150. A nurse is caring for a patient with a diagnosis of anemia. What is the priority intervention? A. Administer iron supplements as prescribed. B. Monitor the patient's hemoglobin levels. C. Encourage a diet rich in iron and vitamin C. D. Provide oxygen therapy as prescribed. Answer. Administer iron supplements as prescribed. Rationale. Iron deficiency anemia is treated with iron supplementation to improve red blood cell production and oxygen delivery. 151. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD. What should the nurse include in the patient's care plan? A. Encourage smoking cessation. B. Administer corticosteroids as prescribed. C. Promote breathing exercises. D. All of the above. Answer. All of the above. Rationale. Smoking cessation, corticosteroid administration, and breathing exercises are essential in managing COPD and improving lung function. 152. A nurse is caring for a patient who has just been diagnosed with diabetes mellitus. What is the priority nursing intervention? A. Provide education on insulin administration. B. Encourage the patient to follow a balanced diet. C. Monitor blood glucose levels regularly. D. Administer oral hypoglycemics as prescribed. Answer. Provide education on insulin administration. Rationale. Teaching the patient how to properly administer insulin is critical to controlling blood glucose and preventing complications. 153. A nurse is caring for a patient receiving 4 fluids for dehydration. What is the priority assessment? A. Monitor for signs of fluid overload. B. Assess the 4 site for signs of infiltration. C. Monitor the patient's blood pressure. D. Assess the patient's urine output. Answer. Monitor for signs of fluid overload. Rationale. Dehydration treatment with 4 fluids may lead to fluid overload, so monitoring for signs such as edema and shortness of breath is essential. 154. A nurse is caring for a patient with a wound infection. What is the priority intervention? A. Administer antibiotics as prescribed. B. Encourage the patient to increase protein intake. C. Apply a clean dressing to the wound. D. Monitor the patient's temperature regularly. Answer. Administer antibiotics as prescribed. Rationale. Antibiotics are crucial in treating wound infections and preventing the spread of bacteria to other areas. 155. A nurse is caring for a patient recovering from surgery. What is the most important intervention to prevent deep vein thrombosis, DVT? A. Encourage the patient to perform leg exercises. B. Apply compression stockings as prescribed. C. Administer anticoagulants as prescribed. D. Encourage the patient to ambulate as soon as possible. Answer. Administer anticoagulants as prescribed. Rationale. Anticoagulants are important in preventing blood clots, especially in patients who are immobile after surgery. 156. A nurse is caring for a patient with a history of peptic ulcer disease. What should the nurse advise the patient to avoid? A. Eating small, frequent meals. B. Drinking alcohol and smoking. C. Taking nonsteroidal anti-inflammatory drugs, NSAIDs. D. Both B and C. Answer: both B and C. Rationale: alcohol, smoking, and NSAIDs can aggravate peptic ulcers by increasing gastric acid production and impairing mucosal healing. 157. A nurse is caring for a patient with a history of myocardial infarction. What is the priority nursing intervention? A. Administer nitroglycerin as prescribed. B. Encourage the patient to rest. C. Monitor the patient's heart rate and blood pressure. D. Provide education on lifestyle changes. Answer: administer nitroglycerin as prescribed. Rationale: nitroglycerin helps relieve chest pain by dilating blood vessels and improving blood flow to the heart. 158. A nurse is caring for a patient with a history of hypertension. What is the most important action the nurse can take? A. Encourage adherence to prescribed antihypertensive medications. B. Monitor the patient's potassium levels regularly. C. Encourage a high-sodium, low-potassium diet. D. Recommend frequent blood pressure checks at home. Answer: encourage adherence to prescribed antihypertensive medications. Rationale: proper medication adherence is essential to control hypertension and reduce the risk of complications like stroke or heart disease. 159. A nurse is caring for a patient with a diagnosis of acute kidney injury. What should the nurse monitor closely? A. Serum creatinine and urine output. B. Blood glucose levels. C. Hemoglobin levels. D. Serum calcium levels. Answer: serum creatinine and urine output. Rationale: monitoring serum creatinine and urine output helps assess kidney function and detect any further decline in renal health. 160. A nurse is caring for a patient with a diagnosis of tuberculosis. What is the priority intervention? A. Administer antituberculosis medications as prescribed. B. Provide supplemental oxygen as prescribed. C. Encourage the patient to rest. D. Implement airborne precautions. Answer: administer antituberculosis medications as prescribed. Rationale: antituberculosis medications are essential in treating the infection and preventing its spread to others. 161. A nurse is caring for a patient with a history of chronic migraines. What is the priority nursing intervention? A. Administer prescribed analgesics for pain relief. B. Encourage the patient to maintain a regular sleep schedule. C. Assess for signs of dehydration. D. Educate the patient on avoiding migraine triggers. Answer: administer prescribed analgesics for pain relief. Rationale: immediate pain relief is a priority to alleviate the distress caused by migraine attacks. 162. A nurse is caring for a patient with a diagnosis of hypothyroidism. What is the priority nursing intervention? A. Administer thyroid hormone replacement as prescribed. B. Monitor the patient's vital signs closely. C. Encourage a low-calorie diet. D. Provide a warm environment for the patient. Answer: administer thyroid hormone replacement as prescribed. Rationale: thyroid hormone replacement is essential for restoring normal metabolic function and preventing complications. 163. A nurse is caring for a patient with a history of stroke. What is the priority action to prevent further strokes? A. Administer anticoagulants as prescribed. B. Encourage a healthy diet and regular exercise. C. Monitor blood pressure regularly. D. Provide education on smoking cessation. Answer: monitor blood pressure regularly. Rationale: high blood pressure is a major risk factor for stroke, so controlling blood pressure is vital in preventing further events. 164. A nurse is caring for a patient with a diagnosis of pneumonia. What is the priority intervention? A. Administer antibiotics as prescribed. B. Provide supplemental oxygen as prescribed. C. Encourage coughing and deep breathing exercises. D. Assess the patient's respiratory rate and effort. Answer: administer antibiotics as prescribed. Rationale: Antibiotics are essential in treating bacterial pneumonia and reducing the risk of complications such as sepsis or respiratory failure. 165. A nurse is caring for a patient with a diagnosis of diabetes mellitus. What is the priority nursing intervention? A. Monitor blood glucose levels regularly. B. Encourage the patient to exercise regularly. C. Provide education on carbohydrate counting. D. Administer insulin as prescribed. Answer. Monitor blood glucose levels regularly. Rationale. Regular blood glucose monitoring allows for early detection and management of hyperglycemia or hypoglycemia. 166. A nurse is caring for a patient who is post-operative following a laparotomy. What is the priority nursing intervention? A. Assess for signs of infection at the surgical site. B. Administer pain medications as prescribed. C. Encourage the patient to perform deep breathing exercises. D. Monitor for signs of bleeding. Answer. Monitor for signs of bleeding. Rationale. Post-operative bleeding can lead to serious complications, so early detection is critical. 167. A nurse is caring for a patient with a history of seizures. What is the priority intervention? A. Ensure the patient's safety during a seizure. B. Administer anti-epileptic medications as prescribed. C. Monitor the patient's respiratory status. D. Provide a quiet and dimly lit environment. Answer. Ensure the patient's safety during a seizure. Rationale. Preventing injury during a seizure is the priority intervention to protect the patient from harm. 168. A nurse is caring for a patient who is at risk for falls. What is the priority intervention? A. Ensure the patient's environment is free from hazards. B. Encourage the patient to wear non-slip footwear. C. Place the patient on a low bed. D. Educate the patient on fall prevention strategies. Answer. Ensure the patient's environment is free from hazards. Rationale. The most immediate risk factor for falls is an unsafe environment, so ensuring a hazard-free environment is a key priority. 169. A nurse is caring for a patient with a diagnosis of chronic pain. What is the priority nursing intervention? A. Administer pain medication as prescribed. B. Assess the patient's pain level regularly. C. Encourage the patient to engage in relaxation techniques. D. Provide education on lifestyle modifications. Answer. Assess the patient's pain level regularly. Rationale. Regular pain assessments are essential to adjust pain management strategies and provide appropriate relief. 170. A nurse is caring for a patient with a diagnosis of hypertension. What is the priority intervention? A. Administer antihypertensive medications as prescribed. B. Monitor the patient's blood pressure regularly. C. Encourage the patient to reduce salt intake. D. Provide education on stress management techniques. Answer. Administer antihypertensive medications as prescribed. Rationale. Administering antihypertensive medications as prescribed is crucial in controlling blood pressure and preventing complications. 171. A nurse is caring for a patient with acute pancreatitis. What is the priority intervention? A. Administer pain medications as prescribed. B. Monitor for signs of infection. C. Provide a low-fat diet. D. Encourage the patient to increase fluid intake. Answer. Administer pain medications as prescribed. Rationale. Acute pancreatitis is often associated with severe pain, and addressing this pain is the priority to improve patient comfort. 172. A nurse is caring for a patient with a diagnosis of heart failure. What is the priority nursing intervention? A. Administer diuretics as prescribed. B. Monitor the patient's vital signs regularly. C. Encourage the patient to avoid salty foods. D. Elevate the patient's legs to reduce swelling. Answer. Administer diuretics as prescribed. Rationale. Diuretics help reduce fluid overload, a key issue in heart failure, and can alleviate symptoms such as shortness of breath and edema. 173. A nurse is caring for a patient with a history of hyperthyroidism. What is the priority nursing intervention? A. Monitor the patient's heart rate. B. Administer thyroid-stimulating hormone, TSH, as prescribed. C. Encourage the patient to increase protein intake. D. Provide a cool environment to reduce symptoms. Answer. Monitor the patient's heart rate. Rationale. Hyperthyroidism can cause tachycardia, and monitoring the heart rate is essential to assess for potential complications. 174. A nurse is caring for a patient with a diagnosis of asthma. What is the priority intervention during an asthma attack? A. Administer the prescribed bronchodilator. B. Encourage deep breathing exercises. C. Provide oxygen as prescribed. D. Administer oral corticosteroids. Answer. Administer the prescribed bronchodilator. Rationale. A bronchodilator provides immediate relief during an asthma attack by opening the airways and improving breathing. 175. A nurse is caring for a patient who is receiving chemotherapy. What is the priority intervention to prevent infection? A. Administer prescribed prophylactic antibiotics. B. Monitor the patient's white blood cell count. C. Encourage the patient to practice good hand hygiene. D. Educate the patient about avoiding crowded places. Answer. Administer prescribed prophylactic antibiotics. Rationale. Chemotherapy can suppress the immune system, so preventing infections with antibiotics is a critical priority. 176. A nurse is caring for a patient with a diagnosis of acute renal failure. What is the priority intervention? A. Monitor urine output closely. B. Administer intravenous fluids as prescribed. C. Assess electrolyte levels regularly. D. Restrict dietary protein intake. Answer. Monitor urine output closely. Rationale. Monitoring urine output helps assess kidney function and identify signs of worsening renal failure. 177. A nurse is caring for a patient with a diagnosis of tuberculosis. What is the priority intervention? A. Administer anti-tuberculosis medications as prescribed. B. Implement airborne precautions. C. Encourage the patient to drink fluids. D. Provide a high-calorie diet. Answer. Implement airborne precautions. Rationale. Tuberculosis is an airborne infection, and implementing precautions helps prevent the spread to others. 178. A nurse is caring for a patient who has undergone abdominal surgery. What is the priority intervention to prevent complications? A. Encourage deep breathing and coughing exercises. B. Administer pain medications as prescribed. C. Monitor for signs of infection at the surgical site. D. Encourage early ambulation. Answer. Encourage deep breathing and coughing exercises. Rationale. These exercises help prevent atelectasis and pneumonia, common post-surgical complications. 179. A nurse is caring for a patient with diabetes mellitus who has a blood glucose level of 60 milligrams per deciliter. What is the priority intervention? A. Administer glucose orally as prescribed. B. Administer insulin as prescribed. C. Monitor the patient's blood pressure. D. Encourage the patient to eat a low-carbohydrate meal. Answer. Administer glucose orally as prescribed. Rationale. A blood glucose level of 60 milligrams per deciliter indicates hypoglycemia, and immediate glucose administration is necessary to prevent complications. 180. A nurse is caring for a patient with a history of seizures. What is the priority intervention during a seizure? A. Ensure the patient's safety by protecting the head and preventing injury. B. Administer anticonvulsant medication. C. Assess the patient's vital signs. D. Document the duration of the seizure. Answer. Ensure the patient's safety by protecting the head and preventing injury. Rationale. The primary concern during a seizure is to prevent injury, especially to the head and body. 181. A nurse is caring for a patient with a diagnosis of pneumonia. What is the priority intervention? A. Administer antibiotics as prescribed. B. Provide supplemental oxygen as prescribed. C. Monitor the patient's respiratory status. D. Encourage the patient to drink fluids. Answer. Administer antibiotics as prescribed. Rationale. Antibiotics are the primary treatment for bacterial pneumonia and help prevent complications such as sepsis. 182. A nurse is caring for a patient with a diagnosis of dehydration. What is the priority nursing intervention? A. Administer intravenous fluids as prescribed. B. Monitor urine output closely. C. Assess electrolyte levels. D. Encourage the patient to increase oral fluid intake. Answer. Administer intravenous fluids as prescribed. Rationale. For fluids are necessary to rapidly restore hydration and electrolyte balance in cases of dehydration. 183. A nurse is caring for a patient with a history of stroke. What is the priority intervention during the acute phase? A. Monitor the patient's neurological status. B. Administer anticoagulants as prescribed. C. Encourage early ambulation. D. Assess the patient's blood pressure. Answer. Monitor the patient's neurological status. Rationale. Monitoring neurological function is essential to detect any changes or worsening of the stroke. 184. A nurse is caring for a patient with a diagnosis of rheumatoid arthritis. What is the priority nursing intervention? A. Administer prescribed anti-inflammatory medications. B. Encourage the patient to engage in physical therapy. C. Monitor for signs of joint deformity. D. Educate the patient on stress management techniques. Answer. Administer prescribed anti-inflammatory medications. Rationale. Anti-inflammatory medications help control pain and inflammation associated with rheumatoid arthritis. 185. A nurse is caring for a patient with a diagnosis of chronic obstructive pulmonary disease, COPD. What is the priority nursing intervention? A. Administer bronchodilators as prescribed. B. Encourage the patient to practice pursed lip breathing. C. Provide oxygen therapy as prescribed. D. Monitor the patient's respiratory rate and effort. Answer. Administer bronchodilators as prescribed. Rationale. Bronchodilators help open the airways and relieve symptoms of COPD, such as wheezing and shortness of breath. 186. A nurse is caring for a patient with a diagnosis of gastritis. What is the priority intervention? A. Administer antacids or proton pump inhibitors as prescribed. B. Encourage the patient to eat small, frequent meals. C. Monitor the patient for signs of bleeding. D. Avoid giving the patient spicy foods. Answer. Administer antacids or proton pump inhibitors as prescribed. Rationale. Medications that reduce gastric acid production help relieve symptoms and promote healing in gastritis. 187. A nurse is caring for a patient with a diagnosis of hypothyroidism. What is the priority nursing intervention? A. Administer thyroid hormone replacement therapy as prescribed. B. Monitor the patient's weight. C. Encourage a high-fiber diet. D. Provide a warm environment. Answer. Administer thyroid hormone replacement therapy as prescribed. Rationale. Thyroid hormone replacement is necessary to restore normal metabolic function and prevent complications of hypothyroidism. 188. A nurse is caring for a patient with a diagnosis of chronic kidney disease. What is the priority intervention? A. Monitor electrolyte levels closely. B. Encourage fluid restriction as prescribed. C. Administer erythropoiesis-stimulating agents. D. Monitor the patient's weight regularly. Answer. Monitor electrolyte levels closely. Rationale. Monitoring electrolytes helps detect imbalances that are common in kidney disease, especially potassium and sodium. 189. A nurse is caring for a patient who has undergone a cholecystectomy. What is the priority intervention postoperatively? A. Assess for signs of infection at the surgical site. B. Encourage early ambulation. C. Monitor the patient's bile output. D. Administer pain medications as prescribed. Answer. Administer pain medications as prescribed. Rationale. Pain control is a priority after surgery to enhance recovery and prevent complications such as deep vein thrombosis. 190. A nurse is caring for a patient with a diagnosis of deep vein thrombosis, DVT. What is the priority intervention? A. Administer anticoagulant medications as prescribed. B. Elevate the affected limb. C. Apply compression stockings as prescribed. D. Monitor for signs of pulmonary embolism. Answer. Administer anticoagulant medications as prescribed. Rationale. Anticoagulants prevent further clot formation and reduce the risk of complications, such as pulmonary embolism. 191. A nurse is caring for a patient with a history of asthma. What is the priority nursing intervention? A. Assess the patient's respiratory rate and effort. B. Administer prescribed bronchodilators. C. Monitor the patient's oxygen saturation. D. Provide patient education on asthma triggers. Answer. Administer prescribed bronchodilators. Rationale. Bronchodilators are essential in managing acute asthma attacks by opening the airways and improving breathing. 192. A nurse is caring for a patient with a diagnosis of hypertension. What is the priority nursing intervention? A. Administer antihypertensive medications as prescribed. B. Monitor blood pressure regularly. C. Educate the patient about lifestyle modifications. D. Encourage weight loss. Answer. Administer antihypertensive medications as prescribed. Rationale. Antihypertensive medications help manage blood pressure and reduce the risk of complications, such as stroke or heart disease. 193. A nurse is caring for a patient who is at risk for falling. What is the priority intervention? A. Ensure the patient's environment is free from hazards. B. Encourage the patient to wear non-slip footwear. C. Place the patient on a low bed. D. Educate the patient on fall prevention strategies. Answer. Ensure the patient's environment is free from hazards. Rationale. A safe environment is the first line of defense in preventing falls, especially in patients with mobility issues. 194. A nurse is caring for a patient with a diagnosis of acute appendicitis. What is the priority intervention? A. Prepare the patient for surgery. B. Administer pain medications as prescribed. C. Monitor for signs of infection. D. Encourage the patient to avoid eating or drinking. Answer. Prepare the patient for surgery. Rationale. Surgery is the primary treatment for acute appendicitis, and preparing the patient for surgery is crucial to prevent rupture. 195. A nurse is caring for a patient who is at risk for pressure ulcers. What is the priority intervention? A. Reposition the patient every 2 hours. B. Assess the patient's skin for signs of breakdown. C. Encourage the patient to eat a high-protein diet. D. Apply pressure-relieving devices. Answer. Reposition the patient every 2 hours. Rationale. Frequent repositioning is a primary intervention in preventing pressure ulcers by relieving pressure on vulnerable areas. 196. A nurse is caring for a patient with a history of depression. What is the priority intervention? A. Provide emotional support and active listening. B. Encourage the patient to engage in activities. C. Monitor the patient for signs of suicidal ideation. D. Educate the patient about medication compliance. Answer. Monitor the patient for signs of suicidal ideation. Rationale. Depression increases the risk of suicide, and identifying suicidal thoughts early is critical to preventing harm. 197. A nurse is caring for a patient who has just delivered a baby. What is the priority nursing intervention? A. Monitor the mother's vital signs and uterine tone. B. Assess the newborn's APGAR score. C. Provide pain relief as prescribed. D. Educate the mother about infant care. Answer. Monitor the mother's vital signs and uterine tone. Rationale. Monitoring the mother's condition helps identify potential complications such as hemorrhage. 198. A nurse is caring for a patient with a diagnosis of cellulitis. What is the priority intervention? A. Administer antibiotics as prescribed. B. Elevate the affected limb. C. Monitor for signs of systemic infection. D. Apply warm compresses to the affected area. Answer. Administer antibiotics as prescribed. Rationale. Antibiotics are the primary treatment for cellulitis to prevent the infection from spreading and causing complications. 199. A nurse is caring for a patient with a diagnosis of iron deficiency anemia. What is the priority intervention? A. Administer iron supplements as prescribed. B. Encourage the patient to eat iron-rich foods. C. Monitor the patient's hemoglobin levels. D. Educate the patient about the importance of iron. Answer. Administer iron supplements as prescribed. Rationale. Iron supplements are essential to replenish iron stores and treat anemia. 200. A nurse is caring for a patient with a diagnosis of hypokalemia. What is the priority intervention? A. Administer potassium supplements as prescribed. B. Monitor the patient's cardiac rhythm. C. Encourage the patient to eat potassium-rich foods. D. Administer intravenous fluids as prescribed. Answer. Administer potassium supplements as prescribed. Rationale. Potassium supplements are needed to correct the potassium deficiency and prevent complications such as arrhythmias.